Hello everybody, how are you? It's Stahlman, I'm your host. It's the Doctor's In Live with TOA, again Monday edition, meaning I'm in Murfreesboro. However, I don't have anybody with me today except Casey, our intrepid producer. And that's an okay thing because I actually have a topic that I'd like to speak to you about that really is my bailiwick. And I have some thoughts about lower back pain that I'd like to share with you. Some of it may be a little controversial to some. Not every practitioner will necessarily agree with me, but I think it's an important thing to think about when it comes to back pain. Anyway, as with all of our episodes, I'm a fellowship trained orthopedic spine surgeon, and I want to just have everybody understand that I'm not currently, today, I'm not your fellowship trained orthopedic spine surgeon. So please consider all this information more for education and informational purposes, maybe a little entertainment, rather than for medical advice. If you need help with a musculoskeletal problem, seek the professionals. Go to TOA.com. You can find out about our practices, our practice locations, our practitioners. You can find the specialist who can help you with your needs. So please go to TOA.com. You can work on starting to make an appointment online. You can look at our media center where we have lots of our archived informational videos and whatnot from a variety of folks in the practice. And I think that's going to be your best resource. Additionally, before I forget, next week we'll be meeting at noon on Monday. Dr. Lucas Ruth, one of our newest members of TOA, will be joining me. He's a joint replacement specialist, and he's going to be talking to us about a topic yet to be determined, but I bet it'll be pretty interesting. He's part of the latest and greatest of those people who've come out of training with the most up-to-date information, so I think it'll really be helpful. Anyway, I wanted to talk a little bit about lower back pain. Now, lower back pain gets put into a gigantic bucket of everything's all the same, it's just lower back pain, and I want to kind of narrow the focus a little bit because I want to answer kind of the question of why. So let's ignore the people with a structural problem, like a fracture or an infection or a ruptured disc or an instability in the spine. That's one category of people that can have low back pain. Let's also kind of ignore the muscular strain. I worked out too hard on Sunday. I worked in the yard on Saturday. I'm stiff and achy, but it's clearly a muscular problem. We're going to ignore those two. What I'd like to talk about is back pain that is a intermittent problem, but a routine problem for people, meaning it recurs periodically. And I'd like to talk a little bit about the whys and what fors. Now, what prompted me to have this discussion was a month or two ago, I think, I received a negative comment on Google about a patient interaction. And it was interesting. I read the review, and you know, nobody likes to hear negative things, but it was an interesting comment because the first line in the comment was, Dr. Stahlman was very nice. Well, that's pretty positive. But then he went on to say that he was disappointed in our interaction. I'm paraphrasing here, particularly because it seemed that all I did was tell him several times that he was middle-aged, and he was disappointed that the money he spent on his copay wasn't really a font of updated information. And the way I look at that review was I didn't quite do my job with regard to educating this person about his situation. He was a younger middle-aged guy, say in his 40s, active, healthy, but he was one of these people that has episodic back pain that's more than just a muscular thing. He doesn't have a structural problem. but he has a spine and he has pain. And these episodes bother him 3 or 4 times a year, sometimes less frequently, sometimes more frequently, fairly random in events, but they're the classic event of his back essentially just shuts down. He hurts, he can't move. It's almost a panic-stricken kind of episode. But typically in the past, it's gotten better within a few days to a few weeks of just being a little bit patient. And that's the kind of person I want to talk about. My typical conversation with somebody has to do with, first off, we want to make sure you don't have a structural problem that is more serious, such as a broken bone or something like that. I also want to educate people about the spine. And I want to try to give them as much information about why, although that question is oftentimes extremely hard to actually answer. There's a lot of people out there, I've done it myself, who basically try to simplify things by saying it's arthritis, or it's degenerative changes, or it's aging changes as the why. It's probably a lot more complicated than that, but that's kind of the easiest way to try to explain things in a language that people kind of understand. But that discussion, unfortunately, can leave people frustrated because they don't see that, and this is where the controversy, at least some people will consider this, they don't see that really back pain is normal. This type of back pain is normal. And what I mean by that is the reason why somebody has the back pain is a natural response. It doesn't mean that there's a structural problem. It doesn't mean that there's something broken or out of place. It's a response of your body to a trigger, and that's usually the why. The trigger can be muscle, it can be joint, it can be ligament, it can be disc, it can be nerve, but something triggers the back into a cascade of response, which often is pain, muscle spasm, inability to move, kind of a frightening episode. And frankly, that's normal. Why is that normal? Well, it's not a signal of bad things happening to you. What it is, it's just a natural response to this trigger, which is, in my opinion, is really related to the moving parts of your body. So we know that the moving parts are the things that wear out. So joints wear down, muscles and ligaments break down, the heart, lungs, eyes, they all move, break down. And that's where we can start seeing increasing triggers of these episodes. Now, some people are lucky. They don't have many, if any, of these type of episodes. But I'll tell you, they're more common than not. Probably, if you look at statistics, 90% of the adult population will have at least one back pain episode that brings them to the doctor, that scares them enough or bothers them enough that will bring them to the doctor in their lifetime. That's a lot of people. In addition, the vast majority of those people don't have just a simple muscle strain or a structural problem. They have something in between. Some people are lucky. They don't have those episodes. Why is that? We have to chalk it up to good luck and maybe some genetics. There are some people who have lots of those episodes. Why is that? It's probably just the opposite. It's probably bad luck and probably genetics. Now, there's some other factors involved with developing breakdown of your lower spine and back pain. We've talked about those in one of my first episodes, which are genetics, time, so aging, things we've done to ourselves, so stress, work, play, those types of things. Sedentary lifestyle, include bad luck in that, what we've done to ourselves. Sedentary lifestyle and cigarette smoking, okay? Well, you can see really only 2 of those things are modifiable. That's into the future, cigarette smoking and sedentary lifestyle. What we've done to ourselves, we wouldn't be here today if we hadn't lived in the past, so that's undoable. But time and genetics continue to play a role. And so we've learned that actually the earliest signs of change that would be considered degeneration or wearing down are found microscopically at the cellular level, even as early in the human being's life from when they become a crawler to a toddler. So when we move from a all fours position to an upright position, we start seeing cellular changes in the discs that is consistent with early degeneration. And so middle age is just a term that is thrown out there, but the aging process, the changes of our body process, start early in life. Some people have symptoms related to those changes earlier than others. Some people, for example, get gray hair at an early age. Some people always keep their hair color. Why is that? That's their luck. That's their genetics. So what we typically think the triggers for back pain in this group of people are, it's usually a combination of structure. It's things that move, so it's the joints, the discs, the ligaments and muscles, the things that pull and push and allow us to maintain posture, against gravity, and that stimulation then creates a cascade effect of response, which, if you remember last week when we talked to Jimmy and he talked about treating the muscle response to an underlying trigger, that's one of the key tenets of physical therapy. The muscles tend to lock up, they go into spasm, they hurt more, they keep you from moving, and then you're locked in. It's like a prisoner. The good news is the ultimate why, the trigger, is a normal process, meaning it's not a disease, it's not an infection or something like that. One of my mentors in training had a philosophy was, and he was actually writing a book before his death, about the concept that here in the United States in particular, but human beings around the world, have created a disease about lower back pain, when we're actually talking about a normal process. The spine is an extraordinarily complicated structure that does lots of things. It protects our spinal cord, nerves, and the organs in our body. It allows us to be upright. It allows us to be extremely mobile and flexible. But because it is so versatile, it's also fairly touchy. It's easy to throw it out of whack. Spines don't like being still. Spines really don't like sitting. That's not a natural position for our body to be in. We were designed millions of years ago to be four-legged creatures. We then developed into two-legged creatures, upright creatures. Our body was designed to move rather than sit still. When we sit, our butts sit on the chair, gravity continues to push us down, and so we actually get shorter and slumpier as we sit. That happens when we stand too, but the advantage of standing is we're kind of moving in 3 dimensions without really thinking about it. When sitting, we lock our positions in a much more confined way, and that can start irritating these worn down or wearing down parts. Now, this is not an age thing, okay? I said that before. This is not, oh, you're getting old. And that's my mistake with the fellow that I referenced. I kept using the term middle age because I thought that he would relate to that. But it was probably a bad choice of words because it's not really a time phenomenon. It's not that we get worse as we get older. But through the majority of our lives, because we're balancing mobility versus sedentary versus lifting versus twisting versus physical exercise and activities, butting up against the body's capability of doing those activities, we can push things too far. And so it's never really, you've done something wrong. It really is just a matter of, it happened, the episode occurs, the vast majority of time we get people past it and they move on with their lives. The biggest fallacy that's part of my mentor's disease of that is back pain concept is that we have some way of keeping it from happening. Unfortunately, we don't. Our bodies need to move. Little things can create a trigger, which then creates the cascade. And so there's just never a realistic way of saying, okay, make me normal, keep this from happening, and guarantee that I won't have it happen in the future. I get asked those types of questions a lot. And unfortunately, to be very honest with you, there's just no way that anybody can guarantee how somebody's going to feel next year, next month, tomorrow, when compared to today. In addition, we cannot tell somebody why specifically this occurs. It's a complex dance. And unfortunately, the human nature is to try to distill everything down into very simple, bite-sized pieces, and unfortunately, we just don't have the ability to do that. So, what we can learn about this is the vast majority of people who have this type of episode, while it's uncomfortable, inconvenient, severe at times, incapacitating at times, these types of episodes are generally self-limited. They will get better as time goes on until the next episode. The biggest trouble we have is giving people the timeline. Unfortunately, Mother Nature doesn't work around a timeline. So I can't tell somebody, okay, you've gotten past this episode, when might I have another one? I don't know. Is this something that's going to be chronic, permanent, that I'm doomed to have this problem forever? Unfortunately, I don't know. And one of the clues to, if you just look around your community, one of the clues to the fact that we really don't have the answers, all the answers, is look at how many venues there are for treating back pain. Kind of from the most complicated down to the simplest. You got a bunch of spine surgeons, orthopedic surgeons, medical doctors, all working on people with back pain problems. You've got a gazillion physical therapists, even more chiropractors, massage therapists, pain management doctors, acupuncturists, herbal supplements. You've got medications over the counter like acetaminophen, Tylenol, ibuprofen, Advil, naproxen, Aleve, and a bazillion prescription medications, all of which we try to throw at this problem, but rarely is, if we had the answer, we wouldn't need all of these numbers of options. You could go to a back pain center, it would fix you, whether that was medication, exercise, whatever, and you'd be done with it, but we don't have that. Why is that? Because the problem is a lot bigger than we can deal with. I think it really is a natural problem that everyone should expect at some degree, at some point in their lives, to have at least one episode. Now, many times people say, oh, I've never had a history of back pain. And while that may be true in some, I think frankly, if you look at people's history, if we could go back and really pull out of our memory banks those episodes, I think the majority, if not everybody, would agree they've at least had one episode that was kept them out of work, kept them down, kept them from doing something, went to the doctor or had treatment. Why don't we think about those? Well, I think our brain doesn't want to remember bad stuff. Our brain says we got over it, therefore it's not a problem. And that's really true. That's a protective mechanism. If everybody, the people with chronic pain that deal with back pain every single day have their hands full emotionally and mentally as well as physically. Because when you feel bad, things don't go well. When you feel bad, your outlook on life really declines. Depression increases, drug dependency and alcoholism increases, family lives decrease, social interactions decrease, capabilities and productivity decrease with chronic pain. We know that. That's the physical and the emotional that you can't separate affecting us in total, and it becomes a vicious cycle. I really feel for those people who have chronic pain problems because, frankly, we have limited options to cure them. We have more strategies to help them, but they're always going to have some degree of problem. I think that's very true for this particular middle category of people who are not structural, who are not just muscular, but have a pain problem episodically. I don't want to leave you with doom and despair because, frankly, I think there's lots of hope if we understand that this is something that life throws at us, we have to deal with a little bit, but this too shall pass in the vast majority of cases. I think working on things that we can help ourselves in our physical being to help us live a better life, to help us push back a little bit on Father Time, and to maximize our function and to minimize our downtime are the simple basic stuff that your mom probably told you about. Get off your butt, don't be sedentary, watch what you put in your mouth, height, stay weight proportionate, don't get obese, exercise and stay moving regularly. It's very important for us to really think at a young age before we start seeing these symptoms crop up to protect us to some degree, to what we can do, from the decline that is inevitable, that is natural, for the longest period of time, really protecting us from the symptoms of that. We can't stop or slow down the aging or wearing out process. That's inevitable. No one wins this battle against Father Time. But what we can do is make our lifestyles a little bit better by embracing an active lifestyle, minimizing a sedentary lifestyle, changing positions, work hard on strength training of the core, which is basically chest down to hips. Flexibility is really important. Being cautious how we bend, lift, and twist. Don't smoke. That kills your discs and kills your moving parts. And be patient with the episodes that occur. Again, I think back pain, for the most part, is normal. Now, I am not a chronic back pain sufferer. I'm sure that that would upset and anger some people, and I don't mean to be flip about it. But this vast majority of people, this gigantic bucket in the middle here, not the structural, not in chronic pain, not the, I overdid it, this middle ground, it's a natural phenomenon. It's meant to happen. It can't be prevented. It can be managed. And that's what I really want people to understand is don't give up hope that, oh, Dr. Stahlman's saying there's nothing I can do. Absolutely not true. When the episode occurs, you and we can manage it away. You can do some things to try to minimize the chance that it's going to occur, whether that's intensity or frequency, but you can't eliminate that chance. There are some people who have more trouble than others. That's probably in part genetically driven. Part of it is the bad luck category that we talked about, and part of it is what we did to ourselves. It's interesting that if you look at the aging population, you know, you would expect, oh my gosh, this is a degenerative problem, therefore it's going to get worse in a linear fashion and I'm going to be terrible when I get older. Frankly, many people who get older who've had lots of back pain, episodic problems in their middle ages, in their prime, in their 20s to 60s, actually feel better because things kind of burn itself out. The joints get so stiff as the time has gone on that the triggers kind of disappear some. Now that's not a guarantee, but that's oftentimes what we see. So, in closing, the way I work, the way I believe, the vast majority of low back pain episodes shouldn't be scary. They can be anxiety provoking when you get impacted acutely, but don't be afraid that this is your fate. Don't be afraid that this is a dangerous or bad problem. Rest assured that the vast majority of times it really is not long-lasting, and it's a natural phenomenon. Now, my advice, and we have the ability to help you manage through it if you can't do it on your own. I will say that it is important to listen to your body, and when things become more constant, chronic, or progressively worsening, there are some things that can creep up on us that can be more unnatural, if you will, or more problematic. Structural things that can develop as the result of degenerative problems. Discs and joints wear down and they can break down. It's not just a simple trigger. The really bad stuff, infections, fractures, tumors, are things that we think about always in people who have had a progressive worsening problem. Now, those aren't common, but they can occur. And so it's important to not just blow things off and say, you know, this has been getting worse and I'm not getting better and it just seems wrong, and there's no reason not to go see somebody about that. I talk to your primary caregiver first. If they have some advice, they may advise seeing one of us. The good news is that the big bucket of episodic back pain, we find that people resolve their episode, continue on with their life. There's a few things they can do to decrease the chance that it's going to happen again, or particularly decrease the severity of the next episode. But we can't prevent that from happening. So we can help you. We want to help you. We want to help manage you. But you don't have to be panicking about that as far as a dire consequence in the vast majority. So I hope that's kind of a roundabout way of kind of talking about this. I hope I've given you some insights into kind of how we think, how I work. Again, the vast majority of back pain does not scare us, meaning it doesn't seem to be associated with anything structural or dangerous. The vast majority of back pain issues can be scary because it locks you down and you're not used to that loss of control, but they get better. And we have techniques and tools to help you get better a little bit faster. So it's something to think about. Think hard about our society these days, and it's more common in the United States than it is in other countries, I'll be frank, that we seem to want to, or seem to believe that we can fix everything with a pill or a simple process and guarantee that something like this will never happen again. We also have the beliefs, and this is probably human nature, that I need to know why something happened. And sometimes we can't answer that question. And in low back pain, many times we can't answer that question. Pictures can't answer it for us. Medical experience can't help us with that. It's something that's more complicated than we really know. And we have to accept the fact, I have to accept the fact, that I can't answer, honestly, the question of why in many cases. And frankly, because it's not something that somebody's done wrong or done to themselves, the answer to the question why, especially if it gets better, really doesn't matter, okay? Because it's not, having the answer won't prevent it from happening again. unless you know, it's the first category over here, which is I overdid it doing too many box jumps at the gym. I mean, that's an easy kind of thing. There's an easy why there. Structurally, there's an easier why there. But this big block here, I think we drive ourselves crazy trying to get to the why rather than let's help you get over it. So I hope this gives you a little bit of insight. I hope it gives you a little bit of solace. This is a universal problem. This, particularly in the first world societies, back pain is a universal problem. And unfortunately, we don't have an easy answer for you as far as why and prevention. Good news is I don't think we need to be scared and panicked when these episodes occur, because they are self-limited and we can help you get past them more quickly. So thank you for your time. I hope that this has been helpful to you. I certainly welcome your feedback. I hope that maybe this fills in some of the blanks that I was trying to give my patient who gave me a poor review. I hope it helps a little bit more about what's going on in my head, because it's sometimes hard to do that in a 10 to 15 minute office visit when there are so many things going about at the same time. And I've been doing this for a long time, and so there's a lot of stuff in my head that may not come out of my mouth. And so I apologize to you. I hope that this hasn't soured your interest in coming back to TOA if you need us. I do appreciate the fact that you said that I was nice, because I try. That was a helpful review that actually helped me think about myself and my ability to try to communicate with others. So I appreciate that. Anyway, so I think that'll be it for today. I think, again, next week we're going to talk with Dr. Lucas Ruth. He's our newest shareholder. He's been in practice with us 2 years now, but he's our newest shareholder. I'm excited to talk to him because I'm sure he has some insight that I have no idea about, because it was 25 years ago that I trained on that kind of stuff. So I'm looking forward to that. I hope you will too. Same time, Monday, noon, next week, Murfreesboro, be there. Lastly, again, if you have questions, if you have comments, if you have concerns, if you have topic ideas, comment below. We'll get to you. We'll answer your questions. We'll get you the right people if needed. Go to TOA.com. Learn about TOA, learn about the practice. We are the largest, oldest musculoskeletal practice in Middle Tennessee, soon to be the largest practice in the state. There's something to be said about that. TOA has been in existence in one form or another since 1927. That's a long time. We have specialists that can help you. So we serve the Middle Tennessee area, Southern Kentucky area, a little bit of toward Eastern Tennessee, a little bit toward Western Tennessee. So we're out there. We can get you the help you need. So TOA.com. Don't hesitate to let us hear from you. Anyway, thanks a lot. Go out there, live your best life. Take care. See you next week.